Welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, Recommendations and Guidelines for Hepatitis C Screening and Testing. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number, email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, continuing education credit will only be awarded for 1 year for nurses expiring on November 30th, 2017, and 2 years for social workers expiring on November 30th, 2018. I'm Renata Anderson, Hepatitis Coordinator for the Alabama Department of Public Health, and with me is Dr. Scott Harris, Assistant State Health Officer for Public Health Area 2. Welcome, Dr. Harris, and thank you for being here.
Thank you, Renata. Thank you for having me.
Dr. Harris, hepatitis C and viral hepatitis is a subject that many primary care providers, frontline workers, outreach workers are hearing more about today. Patients and clients are coming to them with questions, and guess what? They need answers.
Right. We're going to do our best.
So we're glad you're here today to share your presentation.
Sure. Thank you for having me. I'm very excited to be here today. Hepatitis C is an area that's just undergone a revolution, particularly in the past few years. Not so long ago, we didn't have a lot to offer people with hepatitis C. It was a very common problem, and we had virtually nothing to do that could help patients. But over the past decade, and particularly in the past 3 years or so, we've had tremendous advances that have been developed in enabling us to be able to treat these patients and to cure these patients in most cases. And this is really just a completely different world we're living in than we were just a few short years ago with respect to hep C. I've got several things that I want to talk with you about today. I know a lot of our folks are clinical people, and you're seeing patients with hep C, but many of you may not be clinical people. You may be involved in some other aspect of patients with hepatitis C. So I've tried to sort of get on the knife edge and sort of present a lot of clinical stuff, but also a lot of background stuff as well. We're going to do some information, present some information related just to liver functions in general. We want to talk about liver disease in general, and then we'll move on specifically to causes of hepatitis and especially hepatitis C. And then we want to spend some time today understanding who's at risk for hepatitis C, and then how we would diagnose those people and get them linked to care. So to begin with, let's just remind everybody about liver function, hepatic function in general. The liver is a very metabolically active organ. It does a whole lot of very important functions, and it's really important that we keep our livers healthy because they are involved with so many critical physiologic processes. We know that the liver has a lot to do with manufacturing blood proteins. They store nutrients in the body. They manufacture bile, which we use to help digest our food. They store glucose and other forms of energy. And then perhaps most importantly, they break down many toxins that we have, or waste products that we have in the bloodstream, including drugs, including alcohol, and other things as well. So the liver has a lot of very important functions, and we want to make sure that we can maintain those. This is just a little cartoon that I'll put in there, and you can look at this later when these slides are available online, but this is just a nice graphic that shows you the many different functions of the liver. So what do we mean when we say hepatitis? Hepatitis is really just a generic term. Hepatitis means inflammation of the liver, and that's all that you really get from that term. It doesn't specify what kind of hepatitis or what the cause is or what the prognosis is. It simply means that there's inflammation of some kind. Now, we can diagnose hepatitis a couple of different ways. In many cases, it's just diagnosed with a blood test. You can have blood drawn that shows elevated liver functions, and so people have hepatitis, even though they may not be sick at all. They may have no symptoms, but they have elevated blood levels of liver enzymes, and that's hepatitis. People can also have clinical hepatitis, where they have abdominal pain, or they have nausea, or they may have fever, or they turn yellow, they develop jaundice. And so that's what we mean by clinical hepatitis. And many people will have both, but people can have either or, either with symptoms or without symptoms. So hepatitis can be caused by a whole lot of different things. Alcohol is one of the most common causes of hepatitis, and that's a very common thing that people see in practice. But there are other toxins in the environment that we can be exposed to. There are certain forms of genetic diseases that are causes of hepatitis. In our country and in the Western world, we have such an increasing degree of obesity now that we're starting to see what's called non-alcoholic fatty liver disease, or non-alcoholic steatohepatitis. Fat deposition in the liver leads to chronic inflammation and actually leads to forms of hepatitis and even chronic liver disease just related to obesity, and that's unfortunately becoming very common.
And I'm glad that you have that here, talking about that today, because a lot of people are unaware of that. When we talk about hepatitis and fatty liver disease, they don't think about that as hepatitis.
That's exactly right. But as far as the liver is concerned, the liver is inflamed and doesn't act normally, and so that's just another form of hepatitis.
Right.
That's exactly right. One of the many complications of obesity, that we see. So the common causes of hepatitis that we all think about most of the time are infectious causes, and particularly viruses. And there are a lot of viruses that can cause liver inflammation. We have this sort of alphabet soup, and most people have heard all of these letters for hepatitis A and B and C, and there's a D and a E, and there are probably others as well. These are transmitted in different ways in most cases. Some of them only cause a short syndrome, a short illness that people recover from in most cases, but some of them can be chronic as well. We have vaccines for a couple of these, but not for most of these. And of course, we're going to spend most of our time today talking about hepatitis C. And just as a reminder, other viruses that we don't think of as strictly hepatitis viruses can also cause liver inflammation. And so mono or Epstein-Barr virus is one of the most common when people get mono. If you bother to check, they usually have liver inflammation, and you can find hepatitis in those patients, as well as a lot of other common viruses as well. So let's spend the rest of the time today talking about hepatitis C. Hepatitis C was known to exist, although we really didn't know what it was for a long time. Once people started blood transfusions and started doing that on a regular basis, it was recognized that a lot of people after a transfusion would develop clinical hepatitis. Now, once tests were developed to look for hepatitis A or to look for hepatitis B, we realized that most of the people who got hepatitis after a transfusion did not have either A or B. They had sort of an unknown cause, and so for many years, that was what was referred to as non-A, non-B hepatitis. In about 1989, a test was developed that could identify this new virus, which was known as hepatitis C. And now we've realized that most of the transfusion-associated hepatitis was associated with Hep C. All right. Hep C can live outside the body for several hours at least, but in some cases up to a few weeks. So it can be a potential for infection from an inanimate object or from places where blood or body fluids have been. Remember, we don't have a vaccine for hepatitis C. I think most of you watching this webcast are aware of that, but a lot of the general public is not. We have vaccines for hepatitis A and B, and those are commonly given nowadays, but there is no vaccine for hepatitis C.
Well, I think that not just the general public, but I do also, from time to time, run into colleagues who get confused and they think that, yes, there is a vaccine for C, and I have to remind them, no, there's not a vaccine. There's treatment, but not a vaccine. But again, another thing people aren't aware of is we kind of slide past that part where we talk about how the hepatitis C virus can live outside the body. They don't realize how highly infectious this disease is. 3 weeks is a long time, the possibility. And then some other studies, we have seen it even longer.
Yeah, that's a really good point. No, so that's a good question. So the question was, is the disease airborne? And it is not. It's transmitted through blood and body fluids, so it can survive on surfaces that have been contaminated with blood or body fluids for days or weeks. The most common example, and one that we'll talk about a little bit later, is drug paraphernalia. So people that have needles and reuse them days or weeks later, they may be contaminated with hepatitis C and be infectious. Okay, and we're actually going to spend a good bit of time talking about that. I do want to say, just because if you read about Hep C, you'll hear this term a lot. This is more technical than some people might be interested in, but hepatitis C is divided into strains, or what we call genotypes. They're real specific and slightly different forms of hepatitis C. And the reason that's important now is because now we have different treatments. We have mostly oral treatments that can cure hepatitis C, and depending on how you get, depending on which genotype you have, helps determine what type of medicine is going to work for you. These genotypes are kind of divided geographically. Different parts of the world have different kinds of genotypes. What we see in the United States is mostly what's called genotype 1, and this little graphic can show you that the two blue colors there are different subsets of type 1. We have type 1 and A and type 1B, and that's about 80% of the hepatitis C that we have in this country. And it's important for us to know that when we're treating a person, because that helps determine exactly what medicine they get. It also helps us helps us to predict if our treatment's going to work. Some genotypes respond a lot better to therapy than others do. So that's why that's so important. And by comparison, you can see that in different parts of the world, this little graphic shows you the predominant genotypes you see in different parts of the world. So the red color that you see on your screen there is genotype 1, and you can see that's a predominant one in much of the world, including North America. But if you look at the Middle East and Northern Africa and Southern Africa, in Asia, you see that there are other types of hepatitis C that are much more common there. And again, we do have to treat those differently. They don't all respond to the same types of medications. Okay. So what happens if you get acute hepatitis C? Most people don't have symptoms. The majority of people have no symptoms at all, and they're unaware that they're infected unless they manage to get tested for some particular reason. When people do have symptoms, those symptoms are like any other case of clinical hepatitis for the most part. They can have right upper quadrant pain, that is pain over the liver in the upper right part of the abdomen. They can have dark urine, their skin or eyes can turn yellow from jaundice. Sometimes they have fever, and those symptoms can last for a few weeks. It can take a while before those symptoms develop. If you're exposed to hepatitis C, let's say from a needle stick, or from injection drug use, it may take several weeks before those symptoms show up, and on average, a couple of months, on average 7 or 8 weeks, but it can possibly be longer. So sometimes people don't necessarily associate their symptoms with the exposure they had because it doesn't happen right away. It can take several weeks before they realize it. This is a picture that I hope you can see of someone with a yellow eye, a yellow sclera, and this is sort of the classic jaundice that you see in a person with clinical hepatitis. The one thing that we do tend to find in common in all of these people, if we look, is that they have greatly elevated liver function tests. So even though they may not have symptoms, blood work can typically show you that there's liver inflammation going on. So that's acute hepatitis. That's the illness that happens soon after infection. As we'll see, a lot of those people can cure themselves. Their immune response can cure themselves, but many people do not. The majority of people do not. And they go on to develop a chronic infection with hepatitis C. Most people that have chronic hepatitis C also don't have symptoms, or if they do have symptoms, they're very nonspecific. They may have some fatigue, or they may occasionally have nausea, or they feel run down, but they may not necessarily associate that to having hepatitis of any kind. There are a few chronic diseases that we see a lot more commonly in people that have hepatitis C, and one of the most interesting ones is diabetes. People who have chronic hepatitis C are several times more likely to develop diabetes, and not clear why that's the case, but it's an interesting observation. So what happens if you get infected with Hep C? Again, about a third of people, or maybe even a little more, can clear this virus spontaneously. That is, your immune system can rev up and attack the virus and eliminate it. And if you're fortunate enough to be in that category, that's a great place to be, because you've eliminated the infection and you don't have any chronic complications from it. The majority of people, though, do not. The majority of people go on to have chronic infection. The virus sets up infection in the liver and stays there on a chronic basis and causes chronic hepatitis. If you are, we do know what types of people are more likely to cure an infection themselves. You're more likely to spontaneously clear it if you acquire this at a younger age, or if you are female. People that actually have symptoms with hepatitis seem to have a more vigorous immune system response, and so they actually tend to clear it a little bit better. And then there's some genetic factors as well, and we won't talk a lot about that. But we know that people of African descent, African Americans, or anyone of African descent, genetically are less likely to clear an infection. They're more likely to develop chronic hepatitis than other races, and that's related to certain types of genetic factors that are different between certain races. Okay. Now, why is that a big deal? So if you have hepatitis C and you don't have symptoms, why do we care about that? The reason is that it causes chronic inflammation in the liver. When the liver is infected and you develop chronic inflammation, you have periods where the liver gets more inflamed, and then your body can control it and it gets a little bit less inflamed. But over and over, you have these waves of inflammation that produce injury to the liver cells themselves, and eventually that leads to fibrosis or scarring, and can continue to the point where you have cirrhosis, which is a very severely scarred liver. This is just a slide to show you microscopically what's going on. The picture on the left shows a normal liver, and it's healthy and pink. And then with chronic inflammation over time, you get areas of scarring and fibrosis, and then eventually you get to the point, if it continues, where all the normal tissue that you see on the left has suddenly been eliminated on the right by pure scar tissue, and that's what a cirrhotic liver actually is. All right. Now, not everyone goes on to get cirrhosis, but a lot of people do. There's sort of a rule of thumb that after about 20 years of infection, about 20% of people get cirrhosis, and that number tends to increase over time. We don't always know who's going to get cirrhosis and who does not get cirrhosis, but there are definitely some certain factors that increase the likelihood that you're going to get cirrhosis. The most common one by far is alcohol use. People that have chronic hepatitis with hepatitis C, or for any kind of chronic hepatitis for that matter, have to be really careful about alcohol use, and in fact should not use it at all. That seems to make worse any kind of chronic inflammation that you have.
Right. I don't think we could emphasize that enough. And believe it or not, a lot of people aren't aware of that. Mm-hmm. As you say, alcohol use, marijuana use, even some medications people need to be aware of and talk to their physician about that could be counterproductive to their them having hepatitis.
That's a really good point, and I appreciate you making that point. If you're someone who's being diagnosed with chronic hepatitis, it's so important that you understand what you're putting in your body, and you do need to talk to your healthcare professional about that. And it's not only alcohol or marijuana, but it is just ordinary prescription medications or even over-the-counter medications that can be a problem.
Right. You can develop cirrhosis of the liver from alcohol use without having hepatitis C as well?
Yes, that's exactly right.
Okay.
So, yes, so for those of you listening on the broadcast, the question is, can you have cirrhosis from alcohol alone in the absence of hepatitis? And absolutely you can. Alcohol is a hepatotoxin. It's a toxin that affects the liver on its own, apart from any other liver issues that you might have. And so people clearly develop cirrhosis only from alcohol and from no other apparent reason. Hepatitis C, of course, can also cause cirrhosis on its own. And so when you put those two things together, a person with chronic hep C who also uses alcohol, then it's particularly hard on the liver. And those people are much more likely to get cirrhosis than either group alone.
But alcohol also makes them more susceptible to hepatitis C, right?
Yeah, alcohol makes them, it probably doesn't make them more susceptible to contracting the disease, but it makes the complications of having it much worse. Okay. Absolutely right. Okay. All right, so again, cirrhosis sounds bad, but why is it bad? Remember, cirrhosis is scarring of your liver. So when your liver scars down, you get several physical factors that happen. Blood flow doesn't go through your liver normally. It doesn't pass through the liver. And so you actually get like a back pressure of blood that builds up in the circulation that's not able to freely flow and get filtered like it normally would. And that back pressure produces bleeding problems throughout the body and all the parts of the body that drain into that circulation. So people will get an enlarged spleen. They can develop swelling of their abdomen where it's full of fluid because drainage is inadequate. They can develop big enlarged or engorged blood vessels in certain parts of the body, like the esophagus, which we call varices, or even hemorrhoids can become really severe because of that venous circulation that doesn't get to drain normally. So that's really a mechanical or a physical factor. But at the same time, remember the liver also has a lot of important physiologic functions. And so when it's not able to detoxify things or make those normal proteins that we have, you see problems with a tendency to bleed, for example. You see a lot of problems with nutrition, and people just generally feel poorly. They have weakness and fatigue and just don't feel well. And then the other very serious complication is that with chronic cirrhosis, your liver is so scarred down after inflammation that in a certain percentage of people, that will develop into liver cancer. That develops into what we call hepatocellular carcinoma, and that rate may be as high as 3% of people per year. And so with cirrhosis being a disease that's lasts permanently, you can imagine that if you have cirrhosis that lasts for a decade or more, your risk of liver cancer becomes very, very high. Finally, just a picture, again, to sort of remind you of that progression. In the top left there, you see a normal liver. With hepatitis C infection, maybe 3/4 of those people or 80% of those people will go on to develop a chronic hepatitis. And then a certain percentage of those people will develop severe scarring or cirrhosis of the liver, with a smaller number even going on to liver cancer. So that's the reason hepatitis C is such a dangerous infection, and why we want to spend so much time today talking about how to find this and diagnose it. Okay. Just as a reminder before we move on, there are tens of thousands of deaths per year related to hepatitis C. People with hep C are about 12 times more likely to die for any reason as compared with the general population. And that's a point, that really bears mentioning. These people aren't necessarily dying from what we would think of as complications of hepatitis C. They're more likely to die for all causes, for all types of reasons. And so even when we think we've addressed a specific liver injury, the folks who have hep C are more likely to have many other illnesses as well. All right. Remember that for the last decade or so, we've had more deaths every year in this country from hep C than we have even had from HIV. So hep C kills more people every year. All right. We still have somewhere on the order of 15,000 to 20,000 new cases a year in the United States. This is a lower number than we had a couple of decades ago. Overall, the number was even higher in the past, but in younger people, particularly as younger people begin experimenting with injection drug use, we're starting to see increasing numbers of hepatitis C in that population as well. And hepatitis C is the #1 reason in this country that people need liver transplants. Okay. This is just a little graph to show you the incidence of hepatitis C. And remember, incidence means new cases that are appearing every year. So these are the new cases that are appearing in the United States. And it may be a little small for you to read there, but on the far left, it starts in the early 80s, and then it goes all the way up to 2014. And you can see the new cases of hep C were much higher in the mid-80s and up to about 1990. And then that number has fallen off significantly. So the number of new cases have dropped a good bit over the past decade or so. But we continue to have people who live with this disease every day, because when people are infected, without the newest treatments, they tend to have it for life. And so we have many, many people who are continuing to live with this disease now. Amazingly, with all of the problems we have in this country with hep C, we're not necessarily the country that has the biggest problems. This graph sort of shows you in those countries in dark blue, those are the places where hep C has the highest prevalence, where you have the most number of people living with hep C. And North Africa, the Middle East, and then Central and Eastern Asia are the countries that have by far the most hepatitis C, even though we have quite a bit here in North America as well. All right. So who gets hep C? What makes you at risk for hep C? This is the next couple of slides are a combination of several studies that looked at different risk factors. And what they do is they calculate what we call an odds ratio. They calculate what are your odds of getting hep C if you have this category or this exposure compared to people who don't have this exposure. And so right at the top, you can see that people who have used IV drugs even once ever in their life are 50 times more likely to have hepatitis C than people who have never used IV drugs even once in their life. So
that's street IV drug, right?
Yeah, that's right. It's injection. That's correct. We're talking about illicit drug use. We're not talking about people that use, insulin for injection, or people who get antibiotic in the hospital. That's right. It's not just an IV, but it's an illicit or illegal IV drug. That's exactly right. The current problem, in this country now is heroin and hydrocodone derivatives and narcotics is the biggest problem. Opioid injection is a huge problem, and that's driving a lot of the current things we see with hepatitis C. Okay. So if you learn one thing today, please remember injection drug use is by far the biggest risk factor for hepatitis C. There are several others as well, though. Blood transfusion actually remains a risk factor for hepatitis C. Now, we need to explain that because we don't really see hepatitis C at all occurring from blood transfusions that people get nowadays. The blood supply is routinely and regularly screened, and so there is no transfusion-associated hepatitis C to speak of anymore, certainly not in this country. But prior to about 1989 or so, or 1992 or so, there certainly was. And of course, people who have Hep C can keep that for decades. So even today, even though we're 25 years out or more from starting to screen for hepatitis C, we see that there's an about 11 times greater chance of having Hep C if you've ever had a blood transfusion than if you're someone who's never had a blood transfusion, even though we're not seeing new cases of that. But there's still a lot of people walking around out there who acquired it from blood transfusion in the 1980s or before.
And we want to mention that because, and keep the awareness out there because there are a lot of people that don't know that.
That's exactly right. That's a really good point. Many people may have had a blood transfusion when they were a kid, or they may have had a blood transfusion following pregnancy and may not have even been told of it. I mean, if it happened 40 years ago, they just may have no memory.
In their body?
Absolutely.
Wow.
So, yeah, as we'll see, about half of the people in our country that have hepatitis C have never been tested and don't know that. Okay, and so it's unfortunately with a disease that's curable. It's such an unfortunate event when somebody presents decades after they were probably infected, they didn't even know they were infected, and now they've got severe liver problems that we can't reverse, even though they have a potentially curable illness.
And that could have infected other people, right?
Yes, depending on their behavior, absolutely. Absolutely. Okay. There's a few other risk factors there, and we're going to talk about some of them. I won't talk about every one of them. But actually, having been incarcerated is a risk factor for hepatitis C. Now, going to jail in and of itself doesn't give you hepatitis C, but what we see is that there are some similar risk factors between people who are incarcerated and people who have hepatitis C for some other reason. So anyone who's been incarcerated has about a 3 times greater risk of hepatitis C.
Dr. Harris, I do go to the prisons to do education, and I do talk to the inmates, and there are a lot of risky behaviors. Tattooing, and of course there's no sanitary way to tattoo in a prison.
Absolutely.
And unfortunately even drug use in the prison. So
sure.
Yes, a lot of that risky behavior is why we do see inmates with hepatitis C.
Absolutely. That's a very good point. In fact, just actually having a piercing, which is so very common today in our culture, having a piercing, that history gives you about 2 times the chance of having hepatitis C as compared to with someone who's never had a piercing. And it's because sometimes that is done in an unsanitary way if it's done in a non-professional setting. Exactly. Okay. Let me go back to injection drug use. It's such an important risk factor for Hep C that it really does bear repeating. This seems to be the most efficient way to transmit hepatitis C by far. There are several countries, including in North America and in Western Europe, that have done what we call seroprevalence surveys. They go and do surveys of populations of injection drug users and test them. And in many Western countries, the percentage of injection drug users that have Hep C are about 80% or more. So over 80% of all people who inject drugs have hepatitis C. In many of these countries that have done the study. So that's a population that is clearly at risk. That's a very, very risky behavior in sharing needles. I mentioned blood transfusion just a minute ago. Remember, Hep C was what we, before we knew about Hep C, it was referred to usually as non-A, non-B hepatitis. We don't see new cases of transfusion-associated Hep C hepatitis anymore, but remember there are plenty of people walking around out there who had blood transfusions in the late 80s or before who are at risk and who need to be tested if they never have been. All I do want to spend just a minute talking about hepatitis C and sexual transmission. This is an issue that a lot of people have some disagreement about. Remember, hepatitis C is not the same as hepatitis B. Hepatitis B is a different type of viral hepatitis, and in our country, in the Western world, hepatitis B is essentially a sexually transmitted infection. It can certainly be transmitted by needle sticks. You know, all healthcare workers who work in an occupation where they can be exposed to blood and body fluids are required to have hepatitis B vaccines. All kids in this country have had Hep B vaccines since the early 90s, and so we don't see a whole lot of, we don't see the degrees of hepatitis B that we used to, but it clearly is an STD in this country. In many parts of the world, particularly East Asia, it's very common for women to give birth to a baby that's infected with Hep B. That is, the mom's infected with Hep B, and so the baby can be born with hepatitis B. So we know for sure that Hep B is sexually transmitted, and we spend a lot of time trying to educate people about that. All of those factors don't apply necessarily when we talk about hepatitis C. For whatever reason, it's clearly not as easy to transmit sexually. Now, it's not true that it can't be transmitted sexually. It clearly can be. There's some documented cases where everyone would agree that there's sexual transmission. But it's not a very efficient way to do it for whatever reason. It just doesn't happen that much. And so when you look at all the studies that have tried to document sexual transmission, the risk to an uninfected partner, sexual partner of someone with Hep C is probably around 1% a year or less. And so that leads to some disagreement about how do you counsel people. So, for example, if you have a couple who's together and one person has Hep C and the other does not, you know, does that couple need to use condoms to prevent Hep C transmission? And most bodies say no, although not all. There are clearly some that feel differently. But generally speaking, we think the risk of hepatitis C is very low. There are some subsets of those groups in which transmission is more common. In men that have sex with men, for example, their risk of acquiring hepatitis C is much higher than in heterosexual couples by sexual transmission. So certainly some couples ought to be aware of that fact. But generally speaking, sexual transmission is not one of the more common ways that people get it. Do you have anything that you would add about that? Or?
I think you covered it perfectly. We do have a question in the audience, though.
Yeah, sure.
Is the viral load for Hep C as bad as the one for Hep B?
The viral load is just a method for sort of calculating how much virus you have circulating in your body, and you can't directly compare those two necessarily. The viral load gives us an idea of how much virus you have and how you respond to therapy, and it helps us predict how you're going to respond to therapy. But it doesn't necessarily predict how easy it's going to be to transmit sexually. I mean, you might think it would, yeah, but it actually does not. Yeah, you know what we know is that Hep B overall is easy to transmit that way, and Hep C overall just simply is not. So.
Well, I will, since you asked, I will add one thing that most of the research that we have out there shows that the B virus can live and transmit itself in those sexual fluids such as semen and vaginal fluids, whereas the C virus only lives and thrives and transmits itself through blood. So that's another reason why we see a higher transmission of B by sex rather than C.
That's a really good point. There are specific sexual behaviors that can expose people to blood as well, and so it certainly does happen, but it's much less common than you see with hepatitis B for sure. Okay, good question. All right. So again, we've alluded to this so far, but I do want to stop and make the point. There is a reason that we really want to be sure to test these people. Okay. What's the reason? The reason is of the several million, 2.5 to maybe 4 million people with hepatitis C out there, at least half of them are unaware of their diagnosis. Okay, at least half of those people in this country are unaware. Many people just simply don't believe that they're at risk. They can't recall a time or don't wish to recall a time when they could have put themselves at risk. And we'll go over those risk factors in just a minute. But people frequently think that they're not at risk and so don't need to be treated, especially since most of them don't have symptoms. Most of them don't feel ill, and they may not realize that they have any problems until they develop significant liver trouble, which might be decades after they first got infected. We know that the group of people who were born between 1945 and 1965, kind of that baby boomer generation, are the ones who are most at risk for hepatitis C. That's where we see most of the cases. And of the cases we have in our country, about 3/4 or so are thought to be in that age group. They're thought to be people born between those years. So that includes me. I don't have Hep C, but I am part of that age group. So people in my age group need to be tested for hepatitis C, as we'll see. Again, why are we making such a pitch for that now? It's because this is a curable disease. We have oral medicine that you can take for a few weeks only. It's well tolerated, and it can completely cure hepatitis C. It will not necessarily, in fact, it will not cure cirrhosis. It will not cure some liver damage that you may have already sustained, but it can kill hepatitis C and prevent you from having further complications. So we want to catch these people as soon as possible. Yeah.
Do you become immune after you've had it?
No, you do not. So if someone has been taking medicine for Hep C and cured of hepatitis C, they absolutely could become infected again if they expose themselves again. And unfortunately, we have seen that just in the past couple of years. We've seen people who have ongoing risky behavior, and so even though they're cured once, they have reinfected themselves. So which is a real unfortunate situation. Okay, but by curing you, then we hopefully can prevent a person from developing cirrhosis, from developing liver cancer, or from needing a liver transplant. Okay. All right. This little graphic just shows you what the predictions have been for deaths from hepatitis C. As that baby boomer generation begins to age, they have been living with hepatitis C, in some cases 30 years or 40 years for some of them. We're going to begin to see them dying from the complications of hepatitis C. And so that the expectation is that that's really going to peak in the next 15 years or so. We're going to see huge numbers. Now, this forecast is based on not getting treatment to people. This is just sort of a natural history. This is what we would expect if there were no way to treat hepatitis C. But we see that we really have a real possibility of affecting this curve, of trying to push those numbers way down, because hepatitis C is a curable infection. So who do we screen? Who do we want to test? We don't want to test every person in America for hepatitis C, but we want to test people who are at risk. So I'm going to mention some risk categories here, and then I'll go on to show you some real specific recommendations about the groups. We want to screen people that have some kind of identifiable risk factor. So we mentioned those groups of people earlier, people that have injection drug use, people that have had blood transfusions, particularly in the 1980s or earlier, maybe people who've been occupationally exposed. If you're a healthcare worker and you have a needle stick from someone that you know has Hep C, obviously that would be a risk factor. So we want to make sure that we're testing people who have an identifiable risk factor. But beyond that, there are groups of people we know who are just more likely to have Hep C, even if we don't know what their risk factor is. And we want to make sure we're testing people in those groups too. So we know that people in prison are more likely to have hepatitis C, and so in many cases, those folks should be screened. Not all guidelines agree on that, but in many cases, those folks need to be screened. People that are on kidney dialysis, on chronic hemodialysis because of kidney failure, are exposed so often to needle sticks and to blood products that they have an increased risk for hepatitis C. And so people who are on hemodialysis chronically need to be screened at least for hepatitis C. We know that patients that have HIV also are more likely to have hepatitis C than patients who don't have HIV. So that's another high prevalence group or another risk group that ought to be screened. And again, people that you may suspect have hepatitis just based on their blood work or based on their symptoms, clearly those are folks that are going to get tested for hepatitis. And then finally, remember, in 2012, CDC added the recommendation that anyone born in this country between 45 and 65 ought to have a one-time hepatitis C test. And then, of course, additional testing if that's warranted because of their ongoing behavior. But everyone should be tested once in that birth cohort because that group is so commonly found to have hepatitis C. Right. So these are the actual CDC testing recommendations, and this is kind of the take-home message that I hope you'll get today. When you see patients like this, these are the folks that we want you to be sure and test or offer testing to. So persons born between 1945 and 1965, okay? persons who have ever injected illegal drugs even once, including if it was many years ago. All right. It's difficult for people to recall this. Sometimes they, may choose not to recall, or they're embarrassed and don't want to disclose it. But sometimes people simply forget. They may have been a teenager and experimented one time and just don't remember. So it's important to try to get that history out of people if you can. People who had bleeding disorders like hemophilia, who got clotting factors starting in 1987 or before, or 1986 and before, those people need to be screened for hepatitis C if they have not, as well as people who got transfusions or organ transplants before July of 1992, which is when universal Hep C testing came to be. In addition, CDC says that you want to screen long-term hemodialysis patients, as we mentioned. You want to screen people that have known exposures, like we talked about, healthcare workers who have been exposed, or people who've had blood or organ donation from a Hep C positive person. We want to screen all people that have HIV. Obviously, we screen people that have liver disease, and then, of course, don't forget, children born to hepatitis C positive moms are people that we want to screen as well. That's delayed for a year or two. This says 18 months, because they can carry maternal Hep C antibodies in their body for a while that will give you a false positive test. So at about 18 months or later, then they obviously need to be screened for hepatitis C. Now, there's some groups that we're not sure exactly, or CDC has not committed as to whether they necessarily need to be screened, and I think you need to take this on a case-by-case basis when you see someone. People who've had organ transplants since 1992, those people, by and large, are a lower risk group, but that's a group that you might consider testing. People that use intranasal cocaine, in some guidelines, there's recommendation to screen those people for Hep C, and this has to do with the fact that when people use intranasal cocaine, they tend to have bleeding sometimes of their mucous membranes in their nose, and then they tend to share the implements that they use for snorting cocaine. So it's possible to contaminate that with blood and then share that with another person who could put themselves at risk. So again, some guidelines call for screening people who've used intranasal cocaine, although CDC has not definitely said that. And similarly, that applies to tattooing and body piercing. There's certainly a different risk between getting tattooed in a tattoo parlor that's inspected by the state, as opposed to getting tattooed in prison, in an unsanitary condition. So again, you would just want to take that on a case-by-case basis. All right. CDC has not really said whether having STDs or having multiple sex partners is a reason to get screened for hepatitis C. Some other guidelines have said that is enough of a reason. It has to do, again, with what we talked about earlier. What is the actual risk of getting this through sex? And that rate is pretty low, and so many people do not recommend screening people just because of potential sexual exposure. Right. And just as a reminder, people who have normal liver functions, who have normal blood work, and seem to have normal function, that doesn't mean that those folks don't have hepatitis C. So you don't want to not test someone who has an obvious risk factor just because their liver functions might look normal to you. Okay. And then there are some other guidelines, and we won't spend a ton of time going through that, but I will say some other healthcare bodies in this country do recommend Hep C screening on groups, for example, that have had multiple sexual partners, as we talked about a minute ago, or if you've just been incarcerated, or if you're a sexual contact of someone with hepatitis C. So it depends on which guidelines you look at, but generally these are the ones that you would want to take on a case-by-case basis and decide.
And Dr. Harris, that I can remember from our CDC meetings, when we talk about persons with multiple sex partners, I think we're mainly referring to those who do have a high number of sex partners, such as sex workers, when we're talking about those multiple sex partners, and the transmission of Hep C, and also, of course, perhaps drugs being involved. Yeah,
that's a really good point. And, it's often difficult to sort out what all the possible risk factors are. You had asked earlier, or someone had asked about sexual transmission. We do see sexual transmission in couples sometimes, although that number is around 1%. But many of the studies have gone on to look at the actual virus involved, and in many cases, the spouse who shows up with hepatitis C later has a completely different virus than the one that their spouse has, and so we know it must not be the same virus. They contracted it through some other route. They had some other risk factor for hepatitis C, and so it really is hard to sort those things out. People who have multiple sexual partners may very well have other risk factors that we're just unaware of. They do have some risk from sex, but they may have risk for other things too. Mm-hmm. Yeah, that's a very good point. We're going to finish up today and kind of spend the remainder of the time just talking about testing. Testing is actually fairly straightforward, and we'll go through this fairly quickly, and hopefully we'll have some time left over for questions. There are really sort of two main types of tests that we do for hepatitis C. We've mentioned all these people who need to be screened, and so when they come in to get screened, what tests do you want to order? Well, the two main tests. The first is a serologic test, which just looks for antibodies to hepatitis C. This shows if your body's ever seen hepatitis C before and mounted an immune response and made antibodies. And those antibodies tend to last your entire life in most people, in people with normal immune systems, so they can tell whether you've ever been exposed to hepatitis C or not. Now, remember we said when people get infected, maybe a third of them or sometimes more will cure that infection themselves, okay, and they no longer have hepatitis C, but those people will still have these positive antibodies. This original screening test will still be positive, okay. So how do we know if you have ongoing hepatitis C? Well, the second test you can think of as sort of a confirmatory test, and it's a molecular assay that looks for RNA. So RNA is genetic material that you see when you have active replication of the virus. When the virus is actually reproducing in the body, you get this RNA. So we can test for that, and that's a molecular assay, and that tells you that you've either just contracted hepatitis C now or that you have long-standing chronic hepatitis C. So the first test will help us decide if you've ever been exposed, and the second test can help us decide if you have an active infection going on. All right. These next couple of slides just sort of reiterate what we discussed. If you have a hepatitis C serologic test, the initial test, that only tells us that sometime in your life your body has seen hepatitis C. Doesn't tell you necessarily whether you have ongoing infection or not. Okay.
That's important to note because a lot of times people get the antibody test and then they don't go back to get a confirmation, an RNA test, and I'll get a phone call. Well, I know I have hepatitis C because I got a test.
Yeah,
Which test did you get?
Yeah, exactly. That's a very good point. Yeah. Yeah, that only tells us if you've ever been exposed to it, but not if you have ongoing infection. Yeah. Good. Besides the normal EIA test, which is what you would get by having your blood drawn at your doctor's office, there is actually an oral test, the OraQuick. This company makes rapid tests for a number of things, including hepatitis C, and you may have seen one of those, and it's just a quick oral test like this that looks like a pregnancy test that can give you a quick answer. Again, this is just like the other screening test. It can give you sort of a yes or no as to whether you've ever been exposed, but it certainly doesn't tell you whether you have ongoing or active hepatitis, and so a positive test result would need to be confirmed with additional testing. Now, the additional testing, if you have a positive screening test, would be to do one of these molecular assays, all right? And then they can actually confirm active infection. The viral load that was asked about earlier gives you an idea of therapy and whether you're going to respond to therapy and what drugs to use. But essentially, these can give you just sort of a yes-no answer. Yes, you have active virus replicating in your body. And that's really what you want to know when you're trying to make the diagnosis. So here's a little algorithm. The whole talk can kind of be distilled down into this one slide, which just says this is how you test for someone. At the top, you do the first HCV antibody test, again, typically an EIA test. If that person is negative, then you're done. If on the left side of the slide, a negative HCV antibody means that person does not have hepatitis C. Now, there is one exception there. If a person has just been very recently exposed, it can take a few weeks before they produce antibodies. So if you're testing a person who, for example, has a needle stick from a Hep C patient, or there's someone who's just very recently injected drugs, then a single negative Hep C antibody test is not going to be sufficient. It means they don't have evidence of Hep C right now, but there is in a sense, an incubation period, if you will, where they may end up developing hepatitis C. So we normally would retest those people a few weeks later, just to make sure that they remain negative before you call them completely negative. All right. If you see someone who's just being screened because they're in one of those categories and they're getting screened one time, then a single negative antibody test would be sufficient as long as they don't have other risk factors that we know about. Now, to the right side of the slide, you see if a person has a positive Hep C antibody test, then the next step is to perform one of those molecular assays to look for Hep C RNA. Okay. If the RNA is negative, then that means that they don't currently have hepatitis C infection. It means they've been infected in the past. They no longer have hepatitis C. So that could be a person who cured themselves, who had an immune response and cured themselves, or it might be a person who's taken therapy. Normally you'll get that information from the patient, but if a person takes medication and cures themselves of hepatitis C, they'll also have a negative RNA, even though their screening test will remain positive. If their RNA is positive, then that person has an ongoing current hepatitis C infection, and that's the person that we want to get into care. And I'm not going to spend a ton of time going through these, but this information is sort of included in the slide set that you can access once that's put up after this lecture. These are sort of the possibilities of testing. If you have a negative HCV antibody and a negative RNA, then you don't have hepatitis C, and that's what you can tell your patient. Okay. And then these next slides sort of show the same information. If you do have a positive Hep C antibody but a negative RNA test, then you have been infected in the past, but you not currently are. And I'm not going to go through each one of these individually, but there's sort of these combinations, and I'll leave that information for you to have so that you know how to deal with your patient. This is the take-home message once you've got testing. If someone has been newly diagnosed with hepatitis C, they have a positive antibody test, and that person has a positive RNA, and we know that they are currently infected, then this is the information that you want to be sure and give them. Number one is please refer them for continued care. Send them to a primary care person who has experience in treating hepatitis C, or send them to a hepatitis C specialist, a hepatologist, or perhaps an infectious disease specialist. Those are the folks that they really need to see to manage their care, because they can be cured, in most cases. You need to be sure and counsel someone with a new diagnosis to protect their liver from any further harm. So the most important thing is please don't drink. Even moderate drinking can be a problem if you have hepatitis C. So people who have hepatitis C don't need to consume alcohol in any amount. It's also important to make sure they don't contract some other form of hepatitis that might also damage their liver. And so since we have vaccines for hepatitis A and hepatitis B, we want to make sure that our Hep C patients are vaccinated against hepatitis A and hepatitis B, because it would really be disastrous for them to acquire a second viral hepatitis that would injure their liver even more as well. You want to make sure that they don't have other ongoing risk factors, and that applies to anybody, anytime. But if you have a patient with high-risk behavior, such as injection drug use or perhaps even high-risk sexual behavior, you certainly want to counsel that person to change their behavior if at all possible. Because of what we mentioned earlier related to fatty liver, we know that obesity can produce ongoing hepatitis as well. So people with Hep C need to be particularly careful about obesity because they can get more inflammation in their liver than someone with hepatitis C who's not overweight. All right. And then we always want to counsel people about the risk of transmission. People who have been diagnosed with Hep C should not donate blood, of course. They should not donate their organs as well. And they need to be careful about sharing appliances or utensils that could be contaminated with blood, like razors, clippers, toothbrushes, and those sorts of things. All right. And I think that's most of the presentation that we had for today. I think we do have time for some questions or whatever else you'd like to talk about.
Do we have a question from the audience? Email?
Not at the moment.
Okay. I think one thing that I wanted to mention that I think we may have left out, Dr. Harris, we talked a lot about sharing needles and with intravenous drug use, but I think we forgot about other drug equipment. So the possibility of that virus being on all types of equipment that someone who is engaging in intravenous drug use, such as a tourniquet, or even if they're injecting on a surface such as a table and getting that blood on that inanimate object. So that's one thing I think we want to remind people of. Do you want to touch on that a little bit?
Yeah, that's very good. I don't think I could say it better than you did. That's terrific. Hepatitis C can live outside the body for days or weeks, and so you do need to remember that anything that's been contaminated with blood could serve as a vehicle for transmission, and it's not just a needle, as you said.
And you mentioned nasal type equipment too.
Yeah, right. That's some of the discussion about whether to screen people who use cocaine. Again, certainly any type of inhalation kind of utensil that's used for cocaine may be contaminated with blood, and certainly that could put someone else at risk. Absolutely.
Can you be co-infected with B and C at the same time?
Yes. So the question is, can you have hepatitis B and hepatitis C both simultaneously? Absolutely. And you tend to get the worst of both worlds. I mean, both of those are dangerous for your liver, and together they're worse. Yeah.
That's relative to a question I had. If you have one strain, can it develop into another strain as well, or do you have to specifically be, exposed to that strain?
Yeah, generally speaking, you have to contract it separately. The virus will mutate within a person's body over time a little bit, and that's particularly true as people start to use antiviral drugs. We know we'll eventually have resistance. The virus will continue to mutate, but the genotypes we talk about are so distinctive. You certainly would not develop a different genotype. Those are completely separate. And now it's possible to have more than one genotype at once. That has been documented also, although not commonly. But yeah, the genotype you have is the one that you have.
Okay. One more thing. Not me, but friends of mine are in that target age. It's a friend of mine, not me. I really didn't have any risky behavior, but do you recommend people just in that age group just be tested?
Yep. If you're born between 1945 and 1965, you should go to your primary care physician and say, I need a Hep C test. And only once in your life, but you need to have that done if you're in that age group and don't have any other known risk factor. Being in that age group alone is enough of a risk factor that you need to do that.
Okay.
Any other questions? Going once, twice. All right. Well, I believe that concludes our program.
Thank you.
Thank you, Dr.
Very much.
Harris.
Thank you very much.
I'd like to thank our webcast audience, our participants, and our studio audience. This webcast will be on demand at adph.org, and that is it.
All right. Thank you for having me. I appreciate it.